do one of my peer reviews for Janecia. First of all, I want to say that I thought I really liked that you were so clear in your video and that you didn't take long pauses between each assessment. I know that's something I had a problem with in my video, taking really long pauses, trying to remember what exactly I was supposed to assess and trying to make sure I kept everything in order. You performed the initial encounter tasks like checking the patient's chart, providing privacy, IDing the patient with your identifiers, washing your hands, and introducing yourself. I really liked that you incorporated the neurological assessment for orientation into your initial encounter. I thought it made it seem a little more nonchalant, asking, like, when you were asking the patient for their two identifiers, yes, their name, and then you asked if they knew where they were and the date. That kind of makes it seem a little more nonchalant. The patient's not really expecting you to be doing a neurological assessment when you're introducing yourself and trying to ID them. So I think it was nice that you incorporated that into your initial encounter with a patient. You identified why the patient came in for their visit and asked if they were in any pain. For future videos, you should try to use the pain scale of 1 to 10 to have a better idea of where the patient is at pain-wise, if they are in fact in pain, or if they have chronic pain and their normal is like a 4. They could easily say that they are not in pain because they're at a normal level of pain. So they might not even think about it, but that would be something you'd want to document in their chart. You did a good job of making sure to test for all the cranial nerves. In future videos, again, it might be helpful to try to incorporate these into the different areas of assessment, such as testing cranial nerve 2, 3, 4, and 6 when you're doing your whole assessment on the eyes, and then like going down so that you make sure that you don't skip over any areas of assessment or forget certain tests you're supposed to be performing. I know that's something I had a hard time with too. I had to go back after my video and go back over the cranial nerves to make sure I tested all of them. But like in a clinical setting, it would probably be a better idea to just do it all at the same time as opposed to doing all the cranial nerves and then going back and doing the assessments in the same areas. You did a good job of touching on the different assessment areas, but I did notice that you missed a few tests, such as inspecting the thyroid gland and the lower extremity musculoskeletal tests. And it's a lot of information on the rubric that we're supposed to remember, but I think we would all benefit from kind of looking over it a couple times, trying to memorize what exactly we're supposed to be assessing, all the different tests we need to do. And then also the descriptions we're looking for, so the normal descriptions, which we'll also want to incorporate into our videos, making sure that we provide good descriptions of all the areas we assess, and that'll be good practice for when we have to document our findings in a clinical setting. We can be really detailed in our when we update the patient's chart. I also noticed that when you were assessing the patient's ears, you did the push-pull-push tests on each ear separately. So you did your assessment on the right ear with the push-pull-push test, and then like looked in the ear, and then you did the same thing on the other ear. Anytime we're palpating different areas of the patient, we should make sure to be doing it bilaterally, so on both sides at the same time. This will make it easier to identify any abnormalities, especially if one side is like extremely swollen and the other side isn't, or if one side's tender and the other side isn't. So this should be done when you do the push-pull-push test, when you're palpating lymph nodes or like checking the muscles, joints, anything like that. So again, I thought you did a really good job on your video, just a few small adjustments. And I think those, if you incorporate those, your final video will be very thorough and descriptive.